Hello there, welcome into another edition of the Fat Guy Podcast. I am the Fat Guy. Most people just call me Brett Mason. I'm glad you decided to join the podcast and take a listen today, whether this would be your first episode or your 101st episode. I'm glad that you took time to listen. So, right off the bat, I'm not a doctor, I'm not a medical professional, I have no formal medical training, but I have spent since 2013 very intensively studying about diet, health, weight loss, metabolic disease, metabolic syndrome, insulin resistance, prediabetes, type 2 diabetes, heart disease, stroke, all these things. I've lost 125 pounds. I feel better than I've felt probably since the early 90s. I'm pretty confident that I'm going to hit my end goal, which is probably still another 50 pounds to go. And I just feel amazing, and I enjoy helping other people. That being said, before you begin any kind of a medical situation, medical intervention, weight loss program, exercise program, it goes without saying you should consult with a medical professional. My only caveat with that would be is if you talk to your favorite medical professional and you mention a ketogenic diet and they tell you how horrible it is and they don't give you good, sound reasons that apply specifically to you, not to the population as a whole, because there really is no reason that the population as a whole can't thrive on a ketogenic diet. However, specific people with very specific conditions do not need to be doing keto. It's a very tiny, small, incy-bincy fraction of the population. Nevertheless, always consult with a medical professional. So today, I especially think that disclaimer is important because I'm going to be talking about type 2 diabetes. And so I'm hesitant to do so. But I have so many people that ask me, hey, you're losing all this weight, the ketogenic diet sounds great, but I'm a type 2 diabetic and I do it. And my first reply to them, always without fail, is this is the absolute best diet for you if you're a type 2 diabetic. However, I usually don't have a lot of time to clarify, I don't have a lot of time to elaborate, and so I'm going to try to do a little bit of that in this podcast. So I should first say right off the bat that most of the information that you hear me talk about, and I'm not going to get too specific, I'm not going to get off in the weeds, but I'm going to cover the broad bases. And most of the stuff that I'll mention is based off the work of Dr. Ted Naiman, Dr. Sarah Hallberg, and some other medical professionals who deal specifically in helping people reverse type 2 diabetes or improve it using a ketogenic diet. Dr. Sarah Hallberg in particular, who actually not only treats people but gathers data and releases research papers on it to show what happens. And so right off the bat, let me tell you a quote from her. That literally within 2 to 3 days, most type 2 diabetics who start a ketogenic diet begin to immediately feel relief of some of the symptoms associated with their type 2 diabetes. That doesn't mean they're cured, doesn't mean that they can come off of their medicines, whether you be a metformin or whether you're taking exogenous insulin or whatever. You have to take shots or pills. She says a vast majority of people begin to feel some kind of benefits and lessening of symptoms within a few days. Most people, unless they have super serious type 2 diabetes, where they're taking mega doses of insulin and things like that, can actually either come off most or all of their insulin in the first 2-3 weeks, something like that. I mean, that's remarkable. Now, keep in mind that the medical profession tells you that type 2 diabetes is a drug you can't avoid. If you're going to get it, you're going to get it. And once you do have it, it will only progress until it gets worse and worse, and you'll probably die from some of the secondary diseases caused by it, those being heart disease, stroke, cancer, and other type things. So all the latest literature supports the claim and assertion that type 2 diabetes, insulin resistance, metabolic syndrome, all these things, which are all basically the same thing at different stages, contribute, if not solely, at least very heavily towards those diseases. So this is the diseases that are killing us: the heart disease, the brain tumors, strokes, these type things, cancers. So the benefits of lowering your serum insulin levels, it cannot be overstated. It just can't be overstated. See, when you have type 2 diabetes, you don't just have high blood sugar. you have constant elevated blood sugar levels and constant elevated insulin, especially if you're taking insulin. Now, if you're not taking insulin, then you actually have decreased insulin, okay? Or that's not necessarily true. You could have really high levels of insulin and just not be working, and that's true for a lot of type 2 diabetics, and that's what the doctors don't tell you. I find that in my study of the medical literature, what's considered acceptable, what's considered standard of care, they don't talk about how your body is pumping tons of insulin and it just didn't working anymore. They just talk about, we need to give you some more insulin. So the lead up to type 2 diabetes starts way before you're ever diagnosed. As a matter of fact, some of the more prominent researchers, including the names I just mentioned at the beginning of this podcast, say very clearly and unequivocally, if you were diagnosed with type 2 diabetes today, you've probably been diabetic to some level, and that is to say insulin resistance. Your insulin doesn't work right. It doesn't handle the job. For a decade or maybe more. It could be several years, up to a decade, maybe even a couple of decades, because it's a process. It's a snowball process. So it all starts out to where, and make no mistake, fat cells are one of the primary inhibitors of the proper, metabolism of in the body of the insulin to storing the glucose and these type of things. It's also a secondary cause, though, because it begins as a primary cause, I think. But insulin resistance. So, one day, your body just can't deal with the glucose anymore. So insulin does two things. It escorts glucose into the into the muscles and into the liver for energy. It facilitates that. The other thing it does is it's a fat storage hormone, so it tells your body to store fat. So when things start going awry, your body will just compensate by putting out more insulin, and it puts out more and it handles it. But the insulin resistance catches up, and then it has to put out more insulin. And eventually your body catches up, and it has to put up more insulin, and then it has to catch up some more, and this continues and continues. So by the time you get diagnosed as either being pre-diabetic or diabetic, your body has reached the end of what it can do. It literally can't pump out any more insulin. It's pumping the maximum amount of insulin possible, and it isn't satisfactorily affecting your blood sugar levels. And that's the point that a medical intervention is needed. The process started, though, and you had the early stages of it several years, a decade, maybe even several decades before. There's some tests you can take to determine this, but I'm not going to get into that here. It's kind of irrelevant. Well, the only thing that's relevant is, are you ready to intervene? Are you ready to intervene before they have to do a medical intervention? And the second thing I'd like you to know is that the medical interventions actually exacerbate the problem. That's why when they put you on insulin, you continue to go downhill even more in the other areas of your health. Your blood pressure probably goes up higher. Your heart disease gets worse. Your risk of stroke gets worse. Your risk of cancers and possibly even developing cancers gets worse. All these things get worse because you're doing even more insulin. Not only is your body cranking out tons of insulin and it is not enough, now you're jamming even more insulin there. So you have super elevated levels of insulin coursing through your body at all times. And it is wreaking havoc, especially in your cardiovascular system. Primarily and especially in your cardiovascular system. So you can intervene. So here's the thing. First, you need to research a ketogenic diet. You need to understand it. You need to consult with a healthcare professional. But you also need to understand that almost immediately your need for insulin or other medicines will start coming down. So if you continue to take them in the amount that you're taking them now, you're going to go into, some kind of insulin shock or something. So it's not something to be taken lightly, but it's also not something to be so terrified about that you don't do it. Basically you just want to monitor your blood glucose levels a lot. And you'll notice that they're getting lower and lower, and you're like, wow, I need to back off this insulin, or I need to back off this medication. Now, working with a healthcare professional is the optimum way to go, and that's why I say if yours won't work with you, find one that will. Because I'm certainly not trained into how to teach you to properly up your monitoring of your blood glucose and to calculate your dosage of if you're doing insulin or if you're doing other medicines, to calculate those and bring them down. I'm not qualified in that area, but I do know this. when you adopt a ketogenic diet, that will happen. Your need for insulin or whatever drugs you're taking will get less and less. So if you keep taking the same amount, you're going to have an adverse effect eventually. It'd be like a person that doesn't need insulin taking insulin. What's going to happen? Well, you'll still need insulin, but you'll just need less. But you could get that same result. So it needs to be closely monitored. And look, it's not just about you lowering your blood sugar. It's not just about getting to where you don't take insulin anymore. There's a ton of other things going on with that elevated insulin. I highly encourage you to look at the literature, look at the research to see what happens when you have high serum insulin all the time coursing through your veins. The damage that it does. You combine that with high levels of sugar coursing through your veins. The damage that it does is horrible. It's driving you towards death. The medical professionals are wrong. You can reverse. At least clinically, you can reverse it. Now, that doesn't mean that your insulin sensitivity levels will ever be back to perfect like they were. But there is research that shows that you do improve insulin sensitivity. Maybe not to the point it was before you were dysregulated, but you definitely can improve it some. But what you're doing is you're removing the problem. So clinically, your HbA1c will be down and be normal. I was reading a story of a guy the other day. It was 4 months, I think. From 4 months, it was 6 months. In 6 months, he went from having an HbA1c that was, like 12 or 14, some ridiculously high number, down to like 5.6. That's crazy. That's the power of a ketogenic diet. So consult with a healthcare professional. Look, I wish that I could give you exact, specific advice. If you're brave enough to try to undertake it as much as you can on your own, that's a decision you have to make. I don't recommend that at all. I recommend you find a doctor that goes, yes, I've seen the research, I've seen the papers, and I want to get you off medicine. My goal isn't just to have you on higher and higher levels of insulin the rest of your life. Find a doctor whose goal isn't that. Ask the doctor, say, is your goal to keep increasing insulin until I am in the grave? Or will you embrace a goal with me of fixing this with diet and either getting completely off of insulin or getting to where I have to take such small levels that it isn't endangering my health to nearly the degree it is now? That's just my recommendation. But notice there's always a doctor in my recommendation, okay? Now, if you're somebody that just wants to lose weight, you need some help, you don't have super serious medical conditions, look, talk to me. I can help you. I'm happy to work with you. I work with several people. My goal is to get them to their achieved level of health. And so if I can work with you, fine. I post a ton of free information. Like somebody asked me today, do I have to pay you to help me? Well, you don't have to do anything. You don't know. Of course you don't have to pay me. I put out so much free information on this that I can't tell you how many people just listen to my podcast, read the blog, follow me on Snapchat and all that, and they just mimic and learn from that and have success on their own. I talked to somebody about 4 or 5 days ago that did. So yeah, you can do it on your own. Some people require help. Some people need guidance. Some people need inspiration. Some people need motivation. Some people want to not muddle their way through it till they figure it out, like I did, which is a really long process. It takes a long time. Whereas it's easier for them to just come work with me, and in a month or so, I got you nailed down and you're good to go. You understand it, you can master it, you're good at it, you know what you need to do the rest of your life. So I'm willing to work with you if that's something that you're interested in. And by all means, do follow me on the social media for all the free information that I put out. That'd be Instagram, Twitter, Facebook, and Snapchat. My username for all those platforms is Fat Guy Podcast. So just add me, Fat Guy Podcast, on whichever of those platforms you like the best. And let's see if we can help you change your life. It can do it. I promise you can do it. And if you know somebody that's 50 or 100 or 150 pounds overweight and they follow you on Facebook or whatever, share this. Sharing this podcast could literally change that person's life. Could literally change that person's life. My dad died at the age of 60 because he was diabetic his whole life. Now, my dad wasn't type 2. There was no reversing his condition. He had what used to be called juvenile diabetes. Now it's called type 1. So there's no reversing it. But I tell you what, he could have followed this diet and it would have kept his insulin levels really low. And all that damage that happened to his heart and his blood vessels and stuff that ultimately killed him would have been greatly lessened, and I 100% believe my dad would have lived longer. I don't know how much longer. 3 years, 5 years, 10 years, 15 years, I don't know. But I'm convinced from the literature I've read, sorry, get a little emotional talking about my dad. I'm convinced from the literature that I've read he would have absolutely lived longer. He would have absolutely lived longer. I can't help my dad, but I can help other people. And I hope in some way that I've helped you. Thanks for listening. Have a good day.